Welcome to your Aged Care Compass podcast. We help you make sense of the Australian aged care system by having conversations about topics you've asked us about. We're joined by thought leaders, professional experts, and people just like you and I who talk about their experience in the aged care sector. Hi listeners, I'm Michelle, your host, and today I'm joined by speech pathologist Cassandra Agius for an important discussion about the role of the speech pathologist in supporting older people. Cass is a hospital-based speech pathologist with a special interest in neurological rehabilitation. Cass has spent much of her career helping older adults navigate the complexities of ageing, particularly in the areas of communication and swallowing. Cass understands the unique challenges that come with ageing, from cognitive changes to physical difficulties with speaking and swallowing. She works closely with her patients to improve their quality of life, ensuring they can maintain meaningful connections and independence as they grow older. Cass, welcome to the show and thank you for joining me today.
Thanks for having me, Michelle. I'm excited to be here.
Oh, wonderful. Well, let's jump straight in. Cass, what's the role of a speech pathologist in supporting older people?
It's quite interesting, actually. I think with speech pathology, you often have the connotation that we work with children with stuttering or sound disorders or in schools. And there's actually quite a large proportion of us that work with the aging population, and not just with communication, but also with swallowing as well. So yes, speech pathologists work across the lifespan, but not just with talking, but with swallowing.
Excellent. And what are some of the most common challenges older people face with communication and swallowing?
So I can use my fancy words, but basically your food pipe and your windpipe are right next to each other. And sometimes as you get older, your swallowing can get a little bit weak, a little bit wonky, as well as other conditions like Parkinson's disease or dementia can really impact upon someone's ability to swallow food all the way into their stomach. Sometimes it can go into their airway. And that it can cause choking, it can cause something called aspiration and chest infections. So as a speech pathologist, it's actually our role with assessing swallowing and also helping with managing swallowing as well. On the other flip side, like I said before, we work with communication. So not just about how people are talking, so not just the clarity of their speech, but also their ability to understand words, understand instructions, understand sentences, and also find the right words in the dictionary that they have in their brain and to be able to use that in a meaningful way to communicate.
So, Cass, how does the natural ageing process affect speech, voice and communication, even without a diagnosed condition?
So, same from a physiotherapist perspective, if you don't move it, you lose it. And as we get older, we're not moving around as much. We're slowing down. It's part of the ageing process. And obviously that impacts upon not just your muscles for your walking, but it also impacts upon your muscles for your swallowing and your talking. As well as when we get older as well, our thinking and our cognition can change as well. So our ability to think and to problem solve, all of those things can take a little bit more time. And so for a speech pathologist, it's our role to support communication as we age, but also with swallowing as well, recognizing that those muscles are going to get weaker. And so that chewing and swallowing is going to become a little bit more challenging as people get older. Another part of that as well is that eating and talking is such a sensory kind of experience as well. So your hearing and your vision, those are things that can change as you get older. And so they also then have an effect on your ability to hear the people around you, to be able to understand them and to engage in conversations with not just one person, but in a bigger environment. And you find that as people get older as well, they will often have that one-on-one kind of conversation and find that they get lost in group conversation as well. So all of those senses change when you get older. They impact upon really meaningful things in life. And so your talking and your swallowing are such meaningful things that can be impacted.
Absolutely. And you don't think about it, do you? You
No.
think one aspect, but like you're saying, it's a whole range of things that happen. Yeah. What about conditions like dementia or Parkinson's disease? How do they affect communication and swallowing?
They're two of probably the biggest neurological conditions that we see when people get older, and both communication and swallowing are impacted with those conditions. So for Parkinson's disease, specifically, about half of the population of people that have Parkinson's disease will experience dysphagia, which is basically the fancy word for swallowing problems. But even half of those people that identify difficulties with swallowing will actually experience something called silent aspiration. So it means that food and drink can go down the wrong way, but they don't often feel it. So it's like with any of us. It happens all the time. You have a big guzzle of water, you have a bigger cough, it goes down the wrong way. But unfortunately, for people that are aging or that have conditions like Parkinson's disease or dementia or post-stroke, that will become quite frequent for them. And often if we're young or we're strong, we've got a really good cough and we can expectorate that from our airway and it doesn't turn into a chest infection. But for people that are older, they don't have a strong enough cough to get it out. So with Parkinson's disease, sometimes you can't even feel if it goes down the wrong way.
Wow.
So something that we do see with patients that are going to their GP quite frequently and they're reporting they're getting quite frequent chest infections, and they also have a diagnosis of Parkinson's disease or kind of those early onset symptoms that we see, that could be an indicator that they actually might have a dysphagia as well. And some of their food that they're eating and drinking is actually going down the wrong way into their lungs instead of their stomach. Another thing we see often with Parkinson's disease as well is changes in your speech. So with the muscles and how they move, it can really make it challenging to get the words out clearly. So we know what we want to say. We just can't get the words out in a way that's really clearly understood. So some of the characteristics of more so a hyperkinetic dysarthria, which is the type of speech impairment we've seen with Parkinson's disease, is that it's quite short rushes of speech, very quick talking, very imprecise articulation, so talk and very quiet voice as well. So those are some things that we would typically see with someone with Parkinson's disease. And there's lots of clinics and places that can help with working on promoting your voice and your talking and your swallowing with Parkinson's disease as well and maintaining that function. From a dementia point of view, the swallowing is also a challenge. But what we see as well with dementia is the change in thinking and cognition and how that really impacts your ability to understand what people are saying to you and to also have meaningful conversations. So we can see sometimes patients that have dementia that it's challenging for them not only to understand, but to stay on topic and to remember things. And all of those facets of communication really impact upon meaningful relationships. So, and I know something as well that we chatted about a bit before, Michelle, is how, families support that kind of change in communication. And it's really about, as speech pathologists, our role is to assess communication and identify ways that we can externally support. So, potentially asking one-stage commands instead of two-stage commands if we know that person is having difficulty with understanding longer complex information. Also, showing the patient what they want. So instead of saying, get up out of bed, you sit next to them, you show them how to do it. And so they don't need to understand the auditory information. They're seeing you and then they are able to do that as well. So a big part of our role with cognitive communication, especially with someone with a dementia or even post-stroke, is not just doing direct face-to-face therapy and optimization, but looking at their environment and the people around them and educating them about how to have meaningful conversations with that person as they age and as their cognition worsens.
Community pharmacies keep Australia healthy. With 6,000 locations nationwide, they're open early, late and longer for convenient, accessible and safe care. Pharmacists provide home medicine reviews, dose administration aids and essential vaccinations. Thanks to additional training, many can now treat common conditions like ear infections, wounds and skin issues. They also support management of chronic conditions in partnership with your healthcare team. Ask your pharmacist how they can help you and your family stay well. Right. I think you've probably just answered then most of my next question. You're all over this. What strategies do you use to help someone with dementia maintain meaningful communications with their family?
So, Michelle, what I was saying before is really about involving the family and making sure that as a speech pathologist, we've done a really thorough assessment and we understand that person's communication profile. So we understand what is their level of receptive language. So can they understand single words? Can they understand sentence level? Can they understand multiple stage commands? Can they understand paragraph level? The different varying degree of someone's ability to comprehend information. And then using that to give the family strategy. So as I said before, if someone can't understand even single stage commands, we show them, we use tangible items, we use single words, and we modify our communication to improve the comprehension of that patient. As well with the expressive language, you can often see with patients with dementia that they will, sometimes we call it fruit salad speech. They will just have a beautiful yarn about something that's really like exciting for them, but it's completely off topic and it doesn't answer at all the question that someone just posed. But it's about validating that person. And I think communication as you age is such an important part of your quality of life, and about validating that person, whatever kind of communication or expression they choose to put out there, instead of going, oh, Mum, I don't understand what you're talking about. Oh, Mum, you didn't answer my question. Just validating them and bringing them back to topic, or restructuring your question so that they understand it better, using pictures. There's so many things that we can do to adapt our communication to make it more meaningful for someone in that stage of life.
That's great advice. I love that. We have to modify what we're doing and not expect them to fit in with us.
And I think it can be frustrating as well for that communication partner to be like, Mum, I've got something important I need to tell you, and you're just not listening to me and not responding. But I think that I think that's what such a privileged role that I have, is to be able to help that family member understand where that person is and try and help them reconnect. Because I did a talk for some JCU students a little while ago, and allied health is not just about keeping someone alive medically. The goal in the hospital of doctors is to keep someone breathing and keep their heart beating. But as allied health professionals, it is our job for people, whilst they're living, to have meaningful engagement in their life. If you can't swallow, or if you can't communicate, but you're breathing, what quality of life do you have? And I think that's why I love my job so much, that it's obviously in the health field, but we really get to know people. We get to know their families. We get to know what's important to them. And our whole job is about helping them connect with that, instead of just, oh, okay, like we need to make sure you take all your medications today, or we need to make sure you go to your GP. All those things are important. But if you're just sitting at home and you can't eat your favorite food, or you can't connect with your family because you can't communicate, what is that quality of your life that you're living?
Absolutely. Yep. So what are the signs families should look for that suggest an older person may have swallowing difficulties?
It's a really great question. I love this one. Like I was speaking about before, so with swallowing, it's when the food and the drink go down the wrong way. So your obvious one is a bit of a cough, a bit of a throat clear, you feel itchy in your throat. So if you're noticing that an elderly person in your life is coughing and spluttering quite frequently with eating and drinking, or choking, that is obviously an indication of them having some swallowing difficulties. And the other one was, I mentioned briefly before, with Parkinson's disease, is that sometimes with neurological conditions, or even with aging, everything gets a little bit older and the sensation can change. That sometimes food and drink goes down the wrong way and they don't feel it, and there's actually no signs. So frequent chest infections of unknown origin, that is also a big red flag that, oh, there could be something going on with the swallowing here. We should see a speech pathologist.
Okay, excellent. So then how do you assess swallowing problems, and what does a typical assessment involve?
It really depends where you're living. Hospital assessments can look very different to what community assessments look like.
Okay.
Basically, part of our job is getting a really good case history and understanding what the person's swallowing problem is like, what their life is like, what they usually eat and drink. Also understanding all their medical conditions, because swallowing problems is often secondary to something else. As we get older, our swallowing can get weaker, but those really significant swallow changes are often secondary to something else, like we discussed, Parkinson's disease, stroke, traumatic brain injury, and acute medical illness. So we start off with just really understanding the person and what their swallowing and communication is like at baseline. Then we would do a cranial nerve assessment and oromotor assessment. So to have a look at the patient's ability to open their mouth, move their tongue, because the information we get from their cranial nerves gives us a bit or more of a picture about what their swallowing is going to look like and guides our assessment.
Okay.
Well, then we would also do a swallow assessment. So that can include just normal eating and drinking, also some modified diet and fluids if we're concerned that something's going down the wrong way. And we also have capacity to do x-rays of someone's swallow, so that a bedside assessment is we're looking for signs and symptoms of it going down the wrong way. But if we need further clarification, hospitals also have the capacity to do a video fluoroscopic swallow study, which is looking at an x-ray of someone's swallow and is a bit more objective of an assessment.
Okay, excellent. And so as a speechy, do you work with dietitians, nurses and carers to manage swallowing risks?
Yes, and that's what a big part of why I love my job as well, that it is so multidisciplinary. And we can't do our job without nurses, doctors, dietitians. So in our hospitals, specifically, our nursing staff are the people that help us carry through strategy. So if patients can't eat and need single teaspoons, they'll be the ones that feed the patients. They're also the ones that are monitoring whether they're able to tolerate the food and drink that they're on. So if they're showing those signs that they're going down the wrong way, they'll be the ones who give us a call and let us know when we'll come and do a reassessment or they'll initiate a referral. Nurses are also so integral with letting us know that whether someone's swallow has improved or declined as well, whether that's in a hospital setting or in the community as well. Dietitians, obviously, when you're looking at swallowing and modifying people's diet and fluids, there's a massive impact upon their nutrition and hydration as well, especially patients that have such difficulty swallowing that they're not safe to have anything to eat and drink. They might need a nasogastric tube specifically, whilst they're in hospital. So talking to the dietitians about the regime that they would need for a nasogastric tube and when they're starting eating and drinking again, what's the balance between what they need through the tube versus how much they're having orally, making sure they're getting the nutrition and hydration, as well as balancing the risks of aspiration is always such a large part of working in a hospital.
Yeah. How do you help older people who have lost their speech due to stroke or illness or whatever find alternative ways to communicate?
So there's 6 areas of practice in speech pathology, and one of them specifically is alternative and augmented communication. And it's providing ways that other than speech for people to communicate. So whether that's through hand gesture, writing, or iPads and apps that can actually talk for people as well. So there's low-tech AC, which is like communication boards, but then there's high-tech AAC for patients that have the cognition to engage in those kinds of technologies, but aren't able to actually talk for themselves. So there's lots of personalized ones they can do, and there's lots of speech pathology practices in community that specialize in high-tech AC as well.
Wow. Okay. Cass, how can older adults themselves be proactive in maintaining strong communication and swallowing health as they age?
That's a really good question, Michelle. And I think that one of the biggest things is just keeping your brain busy and continuing to engage in meaningful activities. I think that it's one of those things about, like I said before, if you don't move it, you lose it. So keeping your brain busy is so important with aging. And also I think just having caring about your health and taking on the recommendations of your GP and taking medications. Like, for example, with Parkinson's disease, with good medication, it really does improve your swallowing and your communication, as well as trying to prevent the risk of stroke, making sure you have your GP and you have your blood pressure checked and all of those kinds of things that can help prevent your swallowing and communication changing over time.
Excellent. And just one final question for today, Cass. How do older people access a speech pathologist? Is there a process they need to follow?
So the best way to see a speech pathologist if someone has concerns is just through your GP. The GP can refer to either the community setting, the hospital or private practice based on what the concern is. Every single health service has a different process about who's eligible for what services, and the GP will know about what pathway to go down, depending on what the concern is for the patient.
Excellent. Well, that brings us to the end of another insightful discussion. Cass, I'd like to extend my thanks to you for giving so generously of your time and expertise today. It's been fabulous learning about the support that speech pathologists can offer to people as they age. Thank you.
Thanks so much for having me, Michelle.
Oh, my pleasure. Thanks for tuning in to another episode. Do you have a topic that you'd like us to cover on an episode? Please reach out and let us know via social media or our website, seemeacn.com.au. That's seemeacn.com.au. All the links are in the show notes. And don't forget to hit the follow or subscribe button so you don't miss any of our upcoming episodes.